Yeah, I've been in practice now for over 20 years in breast surgery, and for a period of time we would use clips as a way of marking the cavity. Not really sure to what extent because there weren't really specialized treatment programs built off of those. Once data for partial breast radiation started to show merit and techniques began to develop, especially with external beams, having a unique signature, something that was, perhaps not only unique but also more workable during oncoplastic surgery, whether it's whatever level of oncoplastic procedure we're doing in patients having breast conservation, became really paramount. And this concept of fiducial markers, which, has existed for other cancer spaces, found its way into breast, probably later than, when it should have. But anyway, fiducial marking found its way into breast at a really opportune time, as I think, a lot of these more advanced breast conservation procedures started to occur. And then it was really about finding the right one. We had multiple iterations from various resources, and the VeraForm to surgeons, at least to this surgeon, and I think a lot of others, based upon how widely it's been adopted, has been a great answer. The usability, you can structure however you want, specific to the cavity, and patients don't know it's there, but the team who's treating the patient know exactly what it is and where it is when it matters.
And you've applied this to level 1 and level 2 oncoplasty?
Yes, because ultimately, with radiation not occurring until after surgery in almost all patients, I don't really know what the final plan is going to be. So marking the patient at the time of surgery, whether ultimately that marker is used or not, I think is important to do. Last thing we want is for a patient to go to a radiation oncologist and have them say, well, I could have offered this if, the cavity was marked.
And are you starting to see the radiation oncologists starting to advocate more for partial breast?
I'm super lucky in my practice. We have done partial breast for many years, and our team is incredibly excited and on board, and they're champions of that technique. Yes, I do see some evolution. It seems like there's always a barrier that really shouldn't be a barrier that exists, but the more successes that we can create, the sooner those barriers will go away.